So, hello students. Hi. All good? Internal assessment marks and all going on. Signing of internal assessment, checking of internal assessment. Okay, bacho, all good. Let us start with abdomen and pelvis. Just the important things in abdomen and pelvis. It's a big topic. So, whatever I can cover in this 1.5 hours to 2 hours, I'll cover. Okay. चलो important topics. हाँ बाकी जो पढ़ना है जो important है what to write that I'll tell you. With this, have a look at this slide. चलो ये slide also you try to identify and just tell what are the things that you're seeing. This is a slide of posterior abdominal wall, correct? Posterior abdominal wall. Can anyone name these muscles here? This is number 1, that's number 2, that's number 3. Yes. Any guesses? What is number 1? These are the muscles which forms the posterior abdominal wall. The posterior abdominal wall is formed by number 1. Who's that? You can guess this. That's a psoas major. Psoas major. Number 2. What's that? Number 2. Any guesses? Number 2 is quadratus lumborum. Quadratus lumborum. And number 3 is, yes, number 3 is transverse abdominis. Transverse abdominis. Take a 1 moment. Okay. Hi, sorry. Okay, I can see your comments now. Hi, Aman. This is evening. Good evening to all of you. Hello to all of you. Right. So this is a slide of posterior abdominal wall. इसमें biceps कहाँ से आता है? Okay. So what is this number 1? Number 1 is, what is this number 1? Psoas major. What is this number 2? That's a quadratus lumborum. And what is this number 3? Number 3 is transverse abdominis. Transverse abdominis. So 3 muscles which forms the posterior abdominal wall: psoas major, quadratus lumborum, transverse abdominis. Fine. Now, what is this plexus that we see on the posterior abdominal wall? This plexus, these nerves that we see arise from a plexus which is known as the lumbar plexus. Lumbar plexus. Okay. So if you can identify this nerves, the branches of lumbar plexus, I'll just put numbers for you. Number 1, 2, this is 3, this is 4, this is 5. This is now deep to this number 6. Chalo bacho, can you just tell me? Yes, Yashika, very good. Very good, Gopal. Very correct. So number 1, what is this nerve? Anyone? Any guesses? What is this nerve? Number 1? Yes, number 1. Okay. No chatting in between. Just answer. बाद में chatting कर लो. What is number 1? Iliohypogastric nerve. What is number 2? Ilioinguinal nerve. Ilioinguinal. ये ilioinguinal nerve और कहीं पे सुना था? Inguinal canal के अंदर. It's a content of inguinal canal. Ilioinguinal nerve. And in males it is spermatic cord. In females it is the round ligament of uterus. Correct? The spermatic cord and ilioinguinal nerve, the round ligament of uterus and the ilioinguinal nerve. Correct? So number 1 is iliohypogastric. Number 2 is ilioinguinal. What is number 3? Any guesses? Any guesses? What is number 3? Okay, what is this number 3? Number 3 is this nerve. This is the nerve which gets compressed against the inguinal ligament. Can anyone tell me what is this nerve? This is the nerve which gets compressed against the inguinal ligament. The person complains of paresthesia, tingling and numbness along the lateral aspect of the thigh. Yes, any guesses? What is this nerve? Lateral cutaneous nerve of thigh. Very good. Lateral cutaneous nerve of thigh is a branch of lumbar plexus. Remember, and this is the nerve which gets compressed against the inguinal ligament. Yes, that is meralgia paresthetica. Meralgia paresthetica. Very good. What is number 4? Number 4 is the genitofemoral nerve. And this genitofemoral nerve divides into 2 branches, a genital branch and a femoral branch. The genital branch of genitofemoral nerve is a content of spermatic cord in males. Genital branch of genitofemoral nerve. And the femoral branch of genitofemoral nerve is, yes, any guesses? The femoral branch of genitofemoral nerve. Where have you heard this? Where have you come across this? Can anyone tell me? The genitofemoral nerve divides into a genital branch, femoral branch. Genital branch goes on the spermatic cord. What about the femoral branch of genitofemoral nerve? Any guesses, bacho? Come on, come on, come on. You can answer this. A very important MCQ. It comes in the lateral compartment of the femoral sheath. Yaad hai? Along with the femoral artery. The femoral artery and the genitofemoral nerve. Femoral and the femoral branch of genitofemoral nerve that comes in the lateral most compartment of the femoral sheath. Excellent. What is this number 5? Number 5 is the femoral nerve. 5 is the femoral nerve, and this femoral nerve lies between two muscles. This muscle, yes, any guesses what is this muscle? That's a iliacus, and that's a psoas major. What do you call this groove as? What is this groove known as? Iliopsoas groove, and the nerve lying in the iliopsoas groove is the femoral nerve. Femoral nerve. Root value बोल सकते हो? Yes, by now you must be knowing the root value of femoral nerve. L2, L3, L4, but L2, L3, L4 obturator nerve का भी root value है. So what is the difference there? It's the dorsal divisions of ventral rami of L2, 3, 4. That's femoral, and the ventral divisions of ventral rami of L2, 3, 4. That's obturator nerve. Okay, fine, perfect. Yes, yes, very good, very nice. You are answering very well. Okay, so that's it. Fine. Can anyone tell me what is this? I'm pointing to something very important for you. This is number 1. Yes. Any guesses? This is number 2. What are these structures like this and like this? And there's something here like this, again here like this, and this. Yes. What is that? Number 1, number 2. Hello, can you guess this? Any guesses? This is number 3. This you should know, bacho. This you should know. Number 3 is the crus of the diaphragm. Crus of the diaphragm, the right and the left crus. Number 1 is the medial arcuate ligament. Yes, very good, Shantanu. And number 2 is the lateral arcuate ligament. The medial and the lateral arcuate ligament and the crus. The medial and lateral arcuate ligament gives origin to the diaphragm. Okay, gives origin to the diaphragm. Now that's the abdominal aorta. Abdominal aorta, and how to remember the branches of abdominal aorta? Look, there's a mnemonic for you. 2, 3, 4, and 5. The branches of abdominal aorta, always asked in the vivas. Comes as a short note in the exam. The branches of abdominal aorta. Abdominal aorta is a continuation of the thoracic aorta at T12 vertebral level. Okay, pierces the diaphragm at T12, becomes the abdominal aorta. Where does the abdominal aorta divide? Can anyone tell me this? Where does the abdominal aorta divide? Yes, Dhruv, hi. Abdominal aorta divides at what level? Can anyone tell me? This is a very important question. Abdominal aorta divides at L4 level. L4 into 2 common iliacs. That's an MCQ, bacho. Yaad rakhna. Abdominal aorta divides at what vertebral level? L4. Remember, whereas IVC is formed at what vertebral level? IVC is formed at L5. L5. IVC is formed at L5, but the abdominal aorta divides at L4 vertebral level into 2 common iliacs. So what are two terminal branches? That is common iliacs. Common iliacs at L4. Very good, Gopal. Very good, Shantanu. Excellent. So what is 3? 3 are ventral branches. The first ventral branch, celiac trunk. The second, superior mesenteric artery. The third is the inferior mesenteric artery. The superior mesenteric artery arises at T12 vertebral level. What does it supply? The foregut. The celiac trunk. The celiac trunk T12 supplies the foregut. The superior mesenteric artery vertebral level is L1. What does it supply? Midgut. And the inferior mesenteric artery vertebral level is L3. What does it supply? Hindgut. All this is very, very important. But this is asked in the vivas, asked as MCQs. So be very clear about all these things. Right. What is 4? 4 would be lateral branches. Lateral branches, and the lateral branches are given to paired organs, right? The organs which are paired. Which is that? The first branch goes up to supply the diaphragm. It supplies the diaphragm from the inferior aspect. Abdomen, man, we are in the abdomen, so it supplies the diaphragm from the inferior aspect. What is that? Inferior phrenic. The second one supplies the suprarenal gland, middle suprarenal. The third is renal, and the fourth is gonadal. Very good. So 4 lateral branches: inferior phrenic, middle suprarenal, renal, and gonadal. Okay, this is a quick revision, bacho. What are maximum I can cover? I'm trying to cover. So be with me and try to recollect what you have read. How much you can recollect? Just see. Fine. And coming to last five. Five are dorsal branches. पीछे होते हैं ये. These are dorsal branches. उसमें we get four pairs of lumbar arteries, four pairs of lumbar arteries, and one artery runs in the midline of the sacrum. That's one median sacral artery. Four lumbar arteries and one median sacral artery. Four pairs of lumbar arteries and one median sacral artery. A very easy way to remember the abdominal aorta. 2, 3, 4, 5. That's it. So if the examiner is going to ask you which is the artery of foregut, yes, celiac trunk. Which is the artery of midgut? Superior mesenteric. Hindgut, inferior mesenteric. And by now you must be knowing foregut extends from where to where? It extends from mouth to the upper half of second part of duodenum, right? Upper half of second part of duodenum up to the opening of bile duct. But the mouth, then esophagus, the stomach, the first part of duodenum, and the upper half of the second part where the bile duct opens. The foregut also includes the liver, the pancreas, and the spleen. Midgut begins from the lower half of the second part of duodenum to, yes, complete the sentence. Midgut begins from the lower half of second part of duodenum to answer. चलो बच्चों, आंसर भी इंटरैक्टिव. टू. बोलो. टर्मिनल इलियम नहीं है सर्जन. No. The midgut extends from the lower half of the second part of the duodenum to, I'm waiting, I'm looking at the screen, I'm waiting, to the right 2/3. Yes, Rachel, to the right 2/3 of the transverse colon. Not half. Right 2/3 of the transverse colon. What is left? Left 1/3 of transverse colon, descending colon, sigmoid, rectum, anal canal, that's hindgut. Right 2/3 of transverse colon. Yes, perfect. Yeah. So that's posterior abdominal wall. क्या याद रखना है? The muscles which forms the posterior abdominal wall. You have to remember the lumbar plexus. You have to remember the abdominal aorta and its branches in the posterior abdominal wall. Perfect. Very good. Okay, what is this? What is this slide indicating? This we'll discuss in the embryology. But you know what is this picture indicating? Like a picture can be kept in the viva and can be asked, what does this signify? Anyone? What does this signify? Answer. Diaphragm. I mean, be specific, bacha. Be specific. It's the development of diaphragm. Development of diaphragm. Anyway, embryos we'll see later. So, development of diaphragm. What is the main contribution to the diaphragm? The main contribution to the diaphragm is septum transversum. Septum transversum forms a major part of the diaphragm. It forms the central tendon of the diaphragm. Central tendon, right? The second is the dorsal mesentery of the esophagus. And this dorsal mesentery of the esophagus is going to form the crust of the diaphragm. This forms the central tendon. Okay, so septum transversum forms the central tendon. The dorsal mesentery forms the crust. The body wall. Body wall. The body wall. What is the body wall form? It forms the peripheral parts of the diaphragm. Forms the peripheral part of the diaphragm. Okay. And what is left now? What is left? What is this known as pleuroperitoneal membranes? What is this going to form? This is going to form the posterior part of the central tendon. The posterior part of the central tendon. Posterior part of central. Okay, so understand the main contribution of the diaphragm to the development of diaphragm. Number one, septum transversum. It forms the central tendon of the diaphragm. The posterior part of the central tendon is derived from the pleuroperitoneal membranes, right? The dorsal mesentery of the esophagus forms the crust of the diaphragm. You know, right and left crust. And the body wall forms the peripheral parts of the diaphragm. Now, bacho, a very common MCQ. If this pleuroperitoneal membranes do not close, this is a canal, pleuroperitoneal canal. The pleural and the peritoneal cavities are continuous. The pleural cavities and the peritoneal cavities are communicating with each other. Later on, we get the formation of a membrane, that's the pleuroperitoneal membranes. If this pleuroperitoneal membranes do not fuse, what happens? Any guesses? A very important clinical question. Failure of fusion of the pleuroperitoneal membranes results in, what is that known as? Is Dhruv, what is that known as? It is known as, इसका नाम है ना बच्चों, it is known as the Bochtelic's hernia. Okay, very good, Shantanu. Very good. It is known as Bochtelic's hernia. What is Bochtelic's hernia? That's a non-fusion of the pleuroperitoneal membranes, right? And who herniates up? The many organs herniates up, but the most important organ is the kidney. Remember, kidney. Okay, clear? Clear to all of you, bachcho? Fine. Okay, so that's about development of diaphragm. Now coming to this anterior abdominal wall. Okay, just listen to the lecture. Those who are in the first year, second year, third year, and interns, just listen, concentrate, understand. If there's any doubt, you can ask me later. Okay, we'll start. So this is the side of anterior abdominal wall. Anterior abdominal wall. Can you identify this muscles? Number 1. This is number 2. This is number 3. This is number 4. That's 5. That's 6. Yes, Rachel. Yes, very good. So what is number 1? What is number 1? That's the external oblique aponeurosis. External oblique aponeurosis. What's number 2? Yes, Rachel. Yes, very good. Number 2 is the internal oblique. Number 3 is the transverse abdominis, right? So external oblique aponeurosis, internal oblique. Third is the transverse abdominis. What is 4? What is number 4? Yes, any guesses? What is number 4? Number 4 is the fascia transversalis. Fascia transversalis. Number 5 is the extraperitoneal fat. And number 6 is the peritoneum. Peritoneum. So this becomes the layers of anterior abdominal wall. Skin, superficial fascia. There is no deep fascia in the abdomen. So skin, superficial fascia. Then starts the external oblique aponeurosis, internal oblique, transverse abdominis, fascia transversalis, extraperitoneal fat, and peritoneum. Peritoneum. Perfect. Okay. So what is this passage here? This is the inguinal canal. Inguinal canal. So the anterior wall, inguinal canal, we have walls. Inguinal canal is an LAQ. LAQ. Just remember this. So we have got walls of the inguinal canal. We have got anterior wall. We have got the posterior wall of the inguinal canal. We have got the roof of the inguinal canal, the floor of the inguinal canal. Okay. Can anyone tell me the anterior wall of inguinal canal is formed by which muscle? It is formed by the external oblique muscle in its entire extent. In its entire extent, it's external oblique. In its lateral part, what is that? Internal oblique. Internal oblique. Earlier we used to say transverse, but now transverse is not taken. So anterior wall in its entire extent is formed by external oblique. In its lateral part, it is formed by internal oblique. The roof is formed by internal oblique plus transverse abdominis. Transverse abdominis. Internal oblique and transverse abdominis. What is this known as? What is this known as? The conjoint tendon. Remember this now? Audio सही नहीं आ रहा है? Okay, fine. Okay, अभी देखिए. Now just see. So the roof is formed by what? The roof is formed by the internal oblique and the transverse abdominis. That together, internal oblique and transverse abdominis को क्या बोलते हैं? What do we call this as? The conjoint tendon. Now is the voice clear? The posterior wall in its entire extent is formed by what? It is formed by the fascia transversalis. Hi, Snehjit. Fascia transversalis. Okay. So the posterior wall in its entire extent is formed by the fascia transversalis. In its medial part, any guesses? In its medial part, it is formed by the conjoint tendon. Conjoint tendon. Okay, right. So anterior wall in its entire extent कौन बनाता है? External oblique. In its lateral part, it's internal oblique. Posterior wall in its entire extent is formed by fascia transversalis. On its medial part, it is formed by the conjoint tendon. But what is conjoint tendon? It is internal oblique and the transverse abdominis. The roof is formed by conjoint tendon, and the floor is formed by the external oblique and inguinal ligament. Inguinal ligament. Clear? So just remember this. हाँ पढ़ लो बच्चों पढ़ लो, but don't disturb. Don't disturb. Okay, clear. So now this inguinal canal has got two openings here. One is the superficial inguinal ring and the other one is the deep inguinal ring. So bachcho, can you tell me this superficial inguinal ring is triangular in shape, and this superficial inguinal ring is a defect in, come on, complete the sentence. The superficial inguinal ring is a defect in. So inguinal canal is an LAQ. ये सब लिखना है. You have to write about the superficial and the deep inguinal ring. You have to write what are the contents of inguinal canal, and finally you have to write the mechanisms which prevent herniation. Okay, चलो बच्चों. The superficial inguinal ring is a defect in external oblique aponeurosis. Superficial inguinal ring is a defect in external oblique aponeurosis, and the deep inguinal ring is circular. It's rounded, right? It's a defect in fascia transversalis. That's a very, very important MCQ. That's a very important Viva question. So superficial inguinal ring is a defect in fascia, in external oblique aponeurosis. The deep inguinal ring is a defect in fascia transversalis, right? What are the contents of inguinal canal? In males, spermatic cord and ilioinguinal nerve. In females, it's the round ligament of uterus and the ilioinguinal nerve. अब ilioinguinal nerve is said to be a partial content. Why? Because it pierces the internal oblique and it comes in the inguinal canal. मतलब it is not throughout the inguinal canal. It comes in between and then leaves through the superficial inguinal ring. So ilioinguinal nerve is said to be a partial content, whereas the spermatic cord and the round ligament are complete contents. ठीक है बच्चों, clear to all of you? Okay, I'll tell you. Just first listen what I'm telling. बाद में कुछ doubts I will see, right? Okay, so what are the contents of spermatic cord? Students, a very important Viva question. The moment you hold the testis, side identification of the testis, what is the examiner going to ask you? What are the contents of spermatic cord? So contents of spermatic cord, yes. Okay, what are the contents of spermatic cord? Number one, the vas difference. Second is the artery to the vas. Third is the cremasteric artery. Fourth is the testicular artery. Fifth is a plexus of veins. क्या बोलते हो? Pampniform plexus of veins. Sixth is a nerve, the genital branch of genitofemoral nerve. And seventh is lymphatics from the testis. You should be perfect with this. Perfect. Yeah, very good, very good. So these are the contents of spermatic cord, right? What are the coverings of testis? Chalo bachcho bolo, this is another very important thing that you should know. What are the coverings of testis? Any guesses? Yes, very good. Coco, very good. What are the coverings of testis? Chalo, let us start with this. Coverings of testis is external spermatic fascia. External spermatic fascia derived from external oblique aponeurosis. Second, cremasteric fascia. Cremasteric fascia derived from cremaster. Cremaster muscle. If cremaster is not in the option, what is the option? बोल सकते हो बच्चों? Cremasteric fascia is derived from. Cremaster is not in the option. What could the second option be? What is the second option? What are the coverings of testis? I'm telling you, coverings of testis. बाहर से अंदर, from outside in, external spermatic fascia which is derived from external oblique aponeurosis. Cremasteric fascia which is derived from cremaster. अगर cremaster option में नहीं है, the answer is internal oblique. याद रखना बच्चों, just remember this because the cremaster muscle is derived from internal oblique. Remember it like that. The cremaster muscle itself is derived from internal oblique. Third is the internal spermatic fascia derived from fascia transversalis. Fascia transversalis. Tunica vaginalis. Tunica vaginalis, that is derived from peritoneal. And the last two layers, tunica albuginea and tunica vasculosa. Vasculosa is derived from blood vessels and albuginea is derived from connective tissue. But you should know this. Coverings of testis is a must. The examiner is going to ask you. So external, outside in, external spermatic fascia which is derived from external oblique aponeurosis, cremasteric fascia which is derived from cremaster / internal oblique, internal spermatic fascia which is derived from fascia transversalis, Tunica vaginalis, 2 layers हैं, parietal and visceral. This is derived from peritoneum. Tunica albuginea, which is derived from connective tissue, and tunica vasculosa, which is derived from blood vessel. Clear? Is this clear to all of you? Hello, bachcho. Okay, just answer this quickly. What is this that I'm drawing? Yeah, even if you're able to answer the visuals, no, bachcho. If you're able to answer the visuals, that means your concepts are clear. Huh? Tell me something I'm drawing for you. What is this that I've drawn? Hello, identify this. Hello, hello. Identify this, number 1, this number 2, and what is this, number 3? Number 1, answer this. This triangle is known as the Hasselbalch's triangle, right? Hasselbalch's triangle, you get MCQs on boundaries of Hasselbalch's triangle. So what is number 1? Number 1 is the rectus abdominis, right? This is the rectus abdominis. Number 2 is what? Inferior epigastric artery. Inferior epigastric artery is a branch of external iliac. Inferior epigastric artery is a branch of external iliac, and number 3 is the inguinal ligament. Inguinal ligament. So ये जो triangle बन गया, this is what we call as the Hasselbalch's triangle. If a hernia comes from the deep ring, enters the inguinal canal and gets out through the superficial ring, what is this hernia known as? This is an indirect inguinal hernia. But if a hernia comes from this triangle, what is this triangle? The Hasselbalch's triangle. What is this hernia known as? This is what we call as a direct hernia. Okay, just remember this. So direct and indirect inguinal hernia. बस ये याद रखना बच्चों. Direct and indirect inguinal hernia. Okay, clear to all of you? ठीक है ना? So if a hernia comes from the deep ring, enters the inguinal canal, gets out through the superficial ring, that's a, what is that hernia? That's an indirect inguinal hernia. And if a hernia comes directly through the inguinal canal, through the Hasselbalch's triangle, that's a direct inguinal hernia. Now, can anyone tell me what is this structure? This is something which divides the Hasselbalch's triangle into 2 parts. What is this, number 4? Number 4. Hello, hello, bachcho. Come on, tell me. What is this, number 4? This is something which divides the Hasselbalch's triangle into 2 parts. So, agar hernia yahan se aata hai, if a hernia comes from here, this is what we call as a medial direct inguinal hernia. And if a hernia comes from here, this is what we call as a lateral inguinal. So who divides the Hasselbalch's triangle into 2 parts? Any guesses? Any guesses? Who divides the Hasselbalch's triangle into 2 parts? Number 4 is the obliterated, the comments, obliterated umbilical artery, or this is what we call as the medial umbilical ligament. Okay, so the obliterated umbilical artery or the medial umbilical ligament is the one which divides the Hasselbalch's triangle into 2 parts. I'm just not able to see this. Comments. So the Hasselbalch's triangle is divided into 2 parts by the obliterated umbilical artery or the medial umbilical ligament. ठीक है बच्चों, clear है? So the Hasselbalch's triangle is divided into 2 parts by the, okay, yeah, okay, just listen to what I'm telling. If you have any doubts, you can ask me later. Fine, clear to all of you? Clear to all of you? So the Hasselbalch's triangle is divided into 2 parts by the obliterated umbilical artery or the medial umbilical ligament, right? We'll discuss the fetal circulation. I just remind me to tell you fetal circulation, that is extremely important, बच्चों. Fetal circulation पे बहुत MCQs है, बहुत MCQs है. It comes as a short note for you, the fetal circulation. Okay, that's fine. Perfect, perfect. Okay, let me tell you the fetal circulation right here on. Okay, I've got a slide here. Chalo, bachcho, we can just quickly go to the fetal circulation. Tell me, what are the contents of umbilical cord? Huh? Now, see, this, what I'm telling you, bachcho, this you have to know. Huh? Just make it a point. You answer, even if it is wrong, that's okay. What are the contents of umbilical cord? Now, this time when I was taking the prelim viva in my college, also I was asking this question. What are the contents of umbilical cord? And still the students were making some mistakes here and there. Contents of umbilical cord are two umbilical arteries and one umbilical vein. Two umbilical arteries and one vein, bacho, one vein. Two umbilical arteries and two vein, one disappears. No, the right disappears and the left is left. What is really fine? Two umbilical arteries and the left umbilical vein. That's the left umbilical vein. Left umbilical vein. There are two umbilical veins, bacho. Okay. Okay, there are two umbilical veins and two umbilical arteries. One goes off and one is left. So who's left? The left is left. Rachel, that's okay. That's okay. Whoever is disturbing, don't pay attention. Just listen, concentrate. Whatever maximum I can tell, I'm trying to tell you. That's fine. So the left is left. Where does the umbilical vein come from? Chalo, bacho, can you answer this? Where does the umbilical vein come from? The placenta, right? So the umbilical vein comes from the placenta, and this left umbilical vein would now go and join someone in the liver. Can anyone tell me? That's the liver. And what is this? Okay, fine. Exception was not asked. Arey, bacho, but contents of umbilical cord, when it is asked, no, immature scalpel, it is two umbilical arteries and the left umbilical vein. Okay, two umbilical arteries and the left. That is what you are going to tell. So this left umbilical vein goes and joins with what? What is this? Specific, bacha, specific. It joins with the left branch of portal vein. When you say portal vein, you have to be very specific. The left umbilical vein goes and joins with the left branch of portal vein. Now the left umbilical vein comes from where? Placenta. If this umbilical vein comes from placenta, it carries pure blood. It would go and join the portal vein. From the portal vein, the blood will go to the liver. The liver will use all this pure blood for its own metabolism. So the entire pure blood will get exhausted. So the entire blood should not go to the liver. There's a big vein here in the liver. That's a IVC. There's a bypass from the left branch of portal vein to the IVC. Any guesses? What is this? That's ductus venosus. So, bacho, what is the ductus venosus connect? Now, if I ask you this, what is the ductus venosus connect? It connects the left branch of portal vein to IVC. It connects the left branch of portal vein to the IVC. This is very specific. If one student comes and tell me the ductus venosus connects the portal vein to the IVC, the other student tells the left branch of portal vein to the IVC, definitely I'll give the other students more marks. Right? Now, from the IVC, the blood comes where? The blood comes to the right atrium. Okay, from the IVC, the blood comes to the right atrium directly. From the right atrium, the blood directly goes to the left atrium. Bacho, how? From the right atrium, the blood directly goes to the left atrium. Yes, what is that? From the right atrium, the blood goes to the left atrium through through foramen ovale. Very good, Shanta. That's the foramen ovale. Fetal life mein, there's a communication between the left and the right atrium. That's the foramen ovale. So the blood goes from the right atrium to the left atrium through the foramen ovale. From the left atrium, the blood goes to the left ventricle. From the left ventricle, it goes to the aorta. Aorta divides into two common iliacs. Common iliac further divides into an external iliac and internal iliac, external iliac. And from the external iliacs, from the internal iliacs, there are two arteries which begins the, and these are the umbilical arteries. So umbilical arteries are branches of what? Bacho, umbilical arteries are branches of internal iliac. They would begin from the internal iliac in the pelvis and they would go up to the umbilicus. They would go to the umbilicus. So where is the internal iliac? ये pelvis में होता है. So they will begin from the pelvis and they would go up towards the umbilicus. So when they are going towards the umbilicus, on the way comes the urinary bladder. That's the bladder. Yeah, urinary bladder. I just drawn one bladder for you. So one umbilical artery goes from this side, one goes from this side. Okay, so two arteries goes on either sides of the urinary bladder to the umbilicus. Fine. Now suppose, bachcho, suppose by chance, if from the right atrium the blood goes to, suppose by chance the blood goes to the right ventricle. From the right ventricle, it would go to the pulmonary trunk. Pulmonary trunk, right? And from the pulmonary trunk, the blood would go to the lungs, correct? But the lungs are not functioning, no, but no, the lungs are not functioning in fetal life. So the blood should not go to the lungs. There's a bypass here from the pulmonary trunk to the aorta. This is what we call as the ductus arteriosus. That's ductus arteriosus. Okay. Clear? Fine, clear to all of you? Fine. Right, so that's ductus arteriosus. Now, this was a question which was recently asked in the FMG exam. How is the ductus arteriosus formed? The ductus arteriosus, how is it derived from? The sixth aortic arch artery between the pulmonary trunk and the aorta. Yes, the sixth aortic arch artery between the lung bud and the aorta. That's fine. So that's the fetal circulation. That's the fetal circulation. Fine, perfect, clear to all of you? So the left umbilical vein goes and joins with the left branch of portal vein. From the left branch of portal vein to the IVC, that's the ductus venosus. From the IVC, the blood goes to the right atrium to the to the left atrium, left ventricle, aorta, common iliac, external, internal. From the internal iliac, ductus arteriosus is always present, bacha. Ductus arteriosus, Rutvi, ductus arteriosus is always present in fetal life. वो बाद में degenerate होता है, right? And from the internal iliac, the umbilical arteries goes towards the umbilicus. Fine, that's about the fetal circulation. Now, what happens after birth? Yes, bacha, what happens after birth? This is gone. This is gone. The left umbilical vein after birth becomes what? Come on, you can answer this. Come on, bacho. The left umbilical vein after birth becomes the ligamentum teres. The left umbilical vein after birth becomes the ligamentum teres, and this ligamentum teres is present in the falciform ligament. You remember falciform ligament? That's a support of the liver. Falciform ligament, that's a ligament of liver. And what is the content of falciform ligament? Ligamentum teres. The ductus venosus after birth becomes what? Ligamentum venosum. Ligamentum venosum. The fossa ovalis, the foramen ovale after birth becomes what? Fossa ovalis. Okay, it becomes a fossa ovalis. Okay, this is a FARRE series. This is a rapid revision. This is a revision just before your exams. Okay, so that's going to be quick revision. This is not like teaching a particular topic. Fine. Ductus arteriosus after birth becomes what? The ligamentum arteriosus. If you revise and come, it would be a good revision. And tell me now, this part of the umbilical artery from the bladder to the umbilicus is going to obliterate off. The part of the umbilical artery from the urinary bladder to the umbilicus obliterates off. This is what we call as the obliterated artery, and this is what we call as the medial. Yes, urachus nahi hai bacha. This is not urachus. This is a medial umbilical ligament. This is the medial umbilical ligament, the same medial umbilical ligament which divides the Hasselback's triangle into two parts. This is what I told you, no? Hasselback's triangle के दो parts है ना. That's a medial umbilical ligament. And what is medial umbilical ligament? It's the obliterated umbilical artery. The umbilical artery begins from internal iliac and goes towards the umbilicus on either sides of the bladder. So the part of the umbilical artery between the bladder and the umbilicus gets obliterated. That's the medial umbilical ligament. And this is the non-obliterated part of the umbilical artery. It begins from the internal iliac. It now supplies the bladder. It is now known as fetal cycle artery. Superior vesical artery. So superior vesical artery is the non-obliterated part of umbilical artery. Perfect, students. Superior vesical artery is the non-obliterated part of umbilical artery, and the obliterated part of umbilical artery becomes the medial umbilical ligament. Hope this is clear to all of you. Clear? Fine. Now, in fetal life, there's a communication between the urinary bladder and the umbilicus. Can anyone tell me what is this? Yes, Snehajit, that is what you are telling me. There's a communication between the urinary bladder and the umbilicus, and this is what we call as the urachus. This is what we call as allantois. Urachus or allantois. So in fetal life, from the apex of the bladder to the umbilicus, there's a communication that's a urachus or allantois. After birth, this obliterates off, and this is what is going to form the median. Any doubts anyone has, you can ask me. So this all comes in MCQs, huh? Median umbilical ligament, that's the obliterated urachus. The medial umbilical ligament, that's the obliterated umbilical artery. Very good, very good. Very good to all of you. In a clinical MCQ comes like this. A small child is brought to the OPD. When the child cries, some straw colored fluid is seen coming out of the umbilicus. What do you feel is this defect? Yes, answer this. Surgeon, very good. Weeping umbilicus, usko kya bolte hain? What do you call this as? It is a urinary fistula. It's a urinary fistula. It is also known as a weeping umbilicus. So if this allantois, if it does not obliterate, the child will pass urine through the umbilicus. This is what we call as a urinary fistula, or it is known as a weeping umbilicus. Weeping umbilicus. Perfect. So fetal circulation is perfect to all of you. Okay. So LAQ stomach, एक बार पढ़ लो stomach का LAQ. Just mention where the stomach is located. The two ends, the two curvatures, the two surfaces of the stomach, the relations of the stomach, the anterior and the posterior relations. Will just be the posterior relation. What is this? That's a lesser omentum. You must be knowing this, lesser omentum, and that's a greater omentum. Fine. The posterior relations of the stomach. Can you tell me this? I'll just point this out for you. Okay. Okay, we'll start. This is number 1. That's number 2. I hope you can see this. That's number 1. Hello, can you see? Posterior relations of the stomach bol raha hu. Yeah, it is also known as the stomach bed. Okay, this is number 3, this is number 4, this is number 5, this is number 6. Come on. Stomach bed. Bacha, will be taking the embryology later. Embryology later will be taking. So what is the stomach bed formed by? The stomach bed is formed by the left kidney. The stomach bed is formed by the left kidney. You get MCQs on all this. Left suprarenal. Stomach bed, left kidney, left suprarenal. Then third is splenic artery. Pancreas. Spleen. Left crus. 6 is left crus. Number 6 and a 6. That's left crus of diaphragm. There's something which is left missing here. What is missing? Can anyone tell me? There's one structure which is missing. What is missing? Left kidney, left suprarenal gland, splenic artery, the pancreas, the spleen, the left crus of the diaphragm. There's something which is left. Something which I'm not drawn or I'm not labeled. Transverse colon. Very good, Rachel. It's transverse colon. Transverse colon. Transverse colon. Transverse colon also comes in the stomach bed. And all the structures are separated from the stomach by what? The stomach is not lying on all the structures. The stomach is not lying on all the structures, but the stomach is separated from all the structures by. Come on, if you can answer this. The stomach is separated from all the structures by lesser sac. Excellent. Very good. Very good. Lesser sac. Excellent. So the stomach is separated from all the structures which forms the stomach bed by the lesser sac. You have to know this. And suppose if any fluid from the lesser sac, what is this? What is all this that I've pointed? What is all this? मतलब what have we opened? Anterior abdominal wall, है ना बच्चा? We've opened the anterior abdominal wall. So between the anterior abdominal wall and the stomach, what is that space known as? That's the greater sac. That's the greater sac. This entire area is the greater sac. So between the anterior abdominal wall and the stomach, that area is the greater sac. From the greater sac, if the fluid has to enter in the lesser sac, how does it go? Through this foramen. It goes through this foramen behind, and this is, yes, answer this, epiploic. That's the epiploic foramen. ठीक है ना? So I'm just trying to correlate things for you. Epiploic foramen. Epiploic foramen का anterior relation is going to be what? Epiploic foramen or the foramen of Winslow, the anterior relation is going to be the lesser omentum. Lesser omentum containing three structures. What are those three structures present in the lesser omentum? The hepatic artery, the portal vein, and the bile duct. Hepatic artery, portal vein, and bile duct. So when I say lesser omentum, it automatically means hepatic artery, portal vein, and bile duct. Anterior relation. What forms the posterior relation? This is anterior. Posterior relation is formed by what? Posterior relation of the epiploic foramen. Anyone? Anyone? IVC. Okay, very good. The posterior relation of epiploic foramen is formed by the IVC. IVC. Superior is, what is that lobe of liver known as? Audite lobe of liver. And inferior. Inferior भी बोल सकते हो. Inferior is the first part of duodenum. First part of duodenum. Excellent. Very good to all of you. So this is about the epiploic foramen or the foramen of Winslow or the adductus to the lesser sac. Boundaries: anteriorly is the lesser omentum containing the hepatic artery, portal vein, bile duct. Posteriorly is the IVC. Superiorly is the caudate lobe. Inferiorly is the first part of duodenum. Excellent. Very good. Very good. Very good. Very good to all of you. Okay. So, bachcho, we will just revise fast. Tell me, duodenum. What is the length of duodenum? Rutvi, lesser sac and lesser omentum. Abhi bolta hu baad mein. Wait. Tell me, duodenum. What is the length of duodenum? Bacha, duodenum is a very, very, very important LAQ. And that's very important. Duodenum and pancreas is a must. You should know it perfectly. Perfectly. Length of duodenum, 25 centimeters. Yes, 25 centimeters. This is the first part. That's the second part. That's the third part. And that's the fourth part of duodenum. 4 parts of duodenum. First, second, third, and fourth. Chalo, bachcho. The entire duodenum is retroperitoneal. Except, answer this. The entire duodenum is behind the peritoneum except a small area of the first part. A small area of the first part and a small area of the fourth part is intraperitoneal. Half of the first part and half of the fourth part, that is intraperitoneal. Pura first part nahi, not the entire first part. First part, half of the first part and half of the fourth part is intraperitoneal. Fine. So we'll start now. First part. If anyone can tell me what is the length. So important points we'll just discuss. What is the length of the first part? Whatever you know, you answer. And bacho, read and come before you come for the revisions. It will be an added advantage for you, right? It will be a two-way communication. What is the length of the first part? Any guesses? Length. 5 centimeters. 5 centimeters. 5 centimeters. It is partially retroperitoneal. Matlab half of it is behind the peritoneum, half of it is intraperitoneal. Now, what is the relation? Anterior relation. Can anyone tell me who comes here like this? What is that? Anterior relations of the first part of duodenum. Can anyone tell this? I've drawn something for you. Anterior relations of the first part of duodenum. First part is 5 centimeters. Bacha, Poco. Gallbladder. Which part of the gallbladder? बच्चा gallbladder के parts होते हैं fundus, body, neck. So that's the neck of the gallbladder. Neck of the gallbladder. Fundus नहीं आता. Fundus of the gallbladder forms the anterior relation of transverse colon. Remember, fundus of the gallbladder. You can say body. That's fine. Body is fine. The fundus of the gallbladder forms the anterior relation of transverse colon. You can say body or the neck. That's neck is also fine. Body and the neck. Posterior relations of the first part. Posterior relation of the first part. This you should know. This comes as a MCQ. Posterior relation of the first part is portal vein, bile duct, and yes, anything else? You get a clinical question here. A person comes to you. Or if there's an ulcer in the duodenum, ulcer in the posterior wall of the duodenum is going to erode which artery? That's a clinical MCQ, and that artery is the gastroduodenal artery. Remember this? Gastroduodenal artery. So the posterior relation of the first part of the duodenum is gastroduodenal artery. And how do you remember this, bacho? This is the artery which is very commonly ruptured in case of duodenal ulcer. A duodenal ulcer is present on the posterior wall. So if the duodenal ulcer is going to erode the wall of the duodenum, it will also erode the artery which lies behind the first part. That's the gastroduodenal artery. It should be perfect. So posterior relation of first part of duodenum is the bile duct, the portal vein, and the gastroduodenal artery. Now coming to the second part of the duodenum. Second part length is 7.5 centimeters. Tell me, what is the anterior relation? Can anyone tell me? There's someone who's going to cross this. What is this structure? Who crosses the second part of the duodenum? That's a transverse colon and mesocolon. That crosses the second part of the duodenum. And what is the posterior relation? Anyone? What is the posterior relation of the second part of duodenum? Dekho bachcho, just see the slide. Just see the slides and try to revise from the slide. The second part of the duodenum is lying on what? Who's this behind? The second part of the duodenum is IVC nahi hai bacha. The second part of the duodenum is lying on the right kidney. A small part of IVC is there, but mainly it is the right kidney. Right kidney. Second part of the duodenum, that's the right kidney. Posterior relation right kidney aata hai. Left pe, that's the head of the pancreas. On the left is the head of the pancreas. Abhijit, head, body bhi nahi, head of the pancreas. That's to the left side. Now, coming to the third part of the duodenum. Bacha, third part of duodenum is very important. The length is 10 centimeters. 10 centimeters. Tell me the anterior relation. Anterior relation of the third part. You can see the third part. What is crossing the third part of duodenum? Any guesses? What is this structure? ये सब है ना visuals आता है. In the NEET PG, this comes as visual slides. Identify the pointed structure. What do you think is this? Root of mesentery. Very good, Shantanu. That's a root of mesentery. Shantanu is answering very well. Niyajit is answering. Very good, bacha. Abhijit, anterior relation पूछ रहा bacha. Abhijit, anterior relation. Root of mesentery. And there's someone else also. Very good. Afan, yes, that's the superior mesenteric vessels. You can see the artery and vein also crossing the superior mesenteric vessels. Superior mesenteric crosses anteriorly the third part of duodenum. Oh, that's okay. Don't say sorry, please. Try to understand, try to get more out of it. Okay, make mistakes here, that's okay. Later, you should be perfect, right? Whatever is done, I'll finish today. What is left, we'll see in the some other lecture again. Okay. Now coming to the posterior relations of the third part. Can anyone tell me the posterior relation? I'll just put number here, number 1, number 2, number 3. Come on, answer this. What's the posterior relation of the third part of it? This you should No. Aorta is fine, bacho. Aorta is fine. Aorta is there. IVC is there. What else is there? What is that? Abhijit? That is psoas major. Yes, that's a right psoas major. That's a right psoas major. Correct. And bacho, there's someone who's lying on the psoas major. There's a tubular structure which lies on the psoas major. Any guesses? Any guesses? What is that tubular structure which lies on the psoas major? Jiska psoas major forms its posterior relation. Genitofemoral nerve is fine, bacha. Genitofemoral nerve is fine. A tubular structure, tubular structure. Any guesses? That's the ureter. That's the ureter. That's the Okay, so the tubular structure is ureter. Clear to all of you? So the right psoas major and the right ureter, the aorta, the IVC, fine, this is going to form the posterior relation of the third part of duodenum. Now coming to the fourth part of duodenum is 2.5 centimeters in length. 2.5 centimeters in length, nothing specific. If you can tell me the posterior relation of the fourth part, what is this structure? What is this structure that I've pointed? Any guesses? What is this structure that I've pointed? I magnified it. Renal vein नहीं है बच्चा. Renal vein नहीं है. I'll give you one hint. MCQ आता है. This structure is related to the paraduodenal fossa. Come on, answer this. This is the structure which is related to the paraduodenal fossa. Very good, Afan. Very good. That's an inferior mesenteric vein. अरे अभिजीत, rectum किधर बच्चा? Rectum is in down in the pelvis. Rectum is in the pelvis, bacha. Okay, so that's the inferior mesenteric vein. We are in the abdomen, huh? You should have an orientation. Abdomen mein hai apan, rectum, anal canal, all down. Okay, that's fine. That's okay, no problem. So this is the inferior mesenteric vein, and there's a sympathetic chain which comes there. And this inferior mesenteric vein is related to what? The paraduodenal fossa. Another very important MCQ. Paraduodenal fossa. 2024 चालू होगा बच्चा. Next month. Okay, so that's the inferior mesenteric vein. Clear to all of you? The duodenum. Can anyone tell me the blood supply of the duodenum? Blood supply of the duodenum. ये 4 parts है duodenum के. Yes, till here, what is the blood supply? This part is derived from foregut and this part is derived from midgut. Above the opening of bile duct, that's foregut. Below the opening of bile duct, that's midgut. So this part of the duodenum is supplied by the superior pancreatico-duodenal artery. Superior pancreatico-duodenal artery, right? And this part is supplied by the inferior pancreatico-duodenal artery. So above the opening of bile duct, it is supplied by superior pancreatico-duodenal artery, and below the opening of bile duct is supplied by the inferior pancreatico-duodenal, right? So duodenum is derived from 2 sources. Yes, this is a branch of celiac trunk. This is a branch of superior mesenteric artery. Very good, bacho. Very good. Now coming to the pancreas. And anyone tell me what are the parts of the pancreas? Parts of the pancreas, that's the head, that's the neck, and the tail. And what is this process here? That's the uncinate process. Now the pancreas is surrounded by the duodenum like this. So that's the head of the pancreas. Head of the pancreas is related to the first part of the duodenum above, the third part of the duodenum below, and the second part of the duodenum on the right side. So that's the head of the pancreas. And this head of the pancreas is related to what? Just look at the slide and tell me. Oh, hello. Voice is not clear. Just try to refresh your app because मेरे यहाँ से सब ठीक है. Just refresh. थोड़ा refresh कर लो app को. But sure, tell me the anterior relation of the head of the pancreas. Just look at the slide. Anterior relation of the head of the pancreas is, who's this? हाँ बच्चा तारिक, ठीक है ले लो. What is that? What is that? The first part of duodenum, right? The first part of the duodenum overlies the head of the pancreas. Yes. The first part of the duodenum lies superior to the pancreas head. It also overlies the head of the pancreas. Plus, what is this? What is this structure? ये क्या है बच्चों? What is this? That's a transverse colon and mesocolon. Transverse colon and mesocolon. So head of the pancreas, the anterior relation is the first part of the duodenum and the transverse colon and mesocolon. What is the posterior relation of the head of the pancreas? Can anyone tell me posterior relation of the head of the pancreas? Right for you. One moment. Hmm. And who's lying on this? On the kidney? What is this? Abhijit, just wait. You'll answer this. I'll start. On this, just place the head of the pancreas. Okay, just place the head of the pancreas on this. This is number one. This is two. That's number three. And that's number four. A very, very easy way to remember the relations of the pancreas. Bacha, pancreas is an LAQ. And to remember the relation is difficult. So just see the slide, draw the slides. Bas utna yaad rakhiye, you'll be able to recollect the relations of the pancreas in the exams. What's number one? Start. Number one is the I. Number one is the IVC. Two is the right renal vein. Number three is the right crus of the diaphragm. Right crus. What's number four? Can anyone tell me what's number four? What's this number four? Hey, ye kya hai? What is this? Kidney. And what is this here? That's the second part of duodenum. The kidney is second part of duodenum. What is number four? Yes, very good, Shantanu. You got this right. Number four is the bile duct. Very good, very good. Bile duct. So just place the head of the pancreas on this structure. All the structure, this becomes the posterior relations of the head of the pancreas, the IVC, the right renal vein, the right crus of the diaphragm, and the bile duct. Here, a perfect. Now tell me, bacho, which part of the pancreas is more prone to cancer? Which part of the pancreas is more prone to cancer? The head. And when there's a cancer of the head of the pancreas, who gets compressed? Bile duct. What does the person get? Obstructive jaundice. Right? Obstructive jaundice. ये सब याद रखना बच्चों. This can see if you know your concepts well, if you know your gross well, the clinical questions are very easy to correlate. बच्चों को difficulty होता है clinical questions में. So just try to understand the gross like this. You'll understand the clinical. Fine. So that's the head of the pancreas. Now coming to the neck of the pancreas. चलो बच्चों, tell me. Neck of the pancreas का anterior relation. Can anyone tell me if that's the first part of the duodenum, what should be this? Yo. If that's the first part of the duodenum, what is this going to be? Anyone? What's this? That's the pylorus of the stomach. Pylorus, the first part of duodenum is related to the head. So before the pylorus, before the first part of duodenum, what comes is the pylorus of the stomach. So what is the anterior relation of the neck of the pancreas? Pylorus of the stomach. And the posterior relation kya hoga? Posterior. Any guesses? Posterior relation. Okay, have a look at this. Have a look at this. One moment. This is the head, neck, and tail. Okay, very good. Tell me what is this vein? And what is this vein? चलो बोलो बच्चों. फार्मर भाग गए ने, उनको उड़ा दिया. That's okay, उनको उड़ा दिया मैंने. Okay, चलो बोलो. So what is this now? That's the splenic vein. Splenic vein. It is, I mean, see, I'm trying to I'm trying to tell what are maximum I can. Now I'm falling short of breath. It is very easy to type anything. That's understood, no? Thoda diya. Chalo bolo. That's a splenic vein. And what is this? That's superior mesenteric. So the superior mesenteric vein and the superior mesenteric artery, artery, they're lying on the what? Uncinate process, and the superior mesenteric vein goes behind the uncinate, behind the neck of the pancreas, who's coming from this side. That's the splenic vein. The superior mesenteric vein and the splenic vein joins to form what? What is this vein, bacha? That's the portal, right? Portal vein. So behind the neck of the pancreas, there are two veins. Can anyone tell me? Behind the neck of the pancreas, there are two veins. Number one is the portal vein, and number two is the superior mesenteric vein. Samajh mein aaya ye? Is this clear? So behind the neck of the pancreas, there are two veins. One is the splenic vein, and then when it joins the one is the superior mesenteric vein, and when it joins with the splenic vein, it becomes a portal vein. So two veins behind the neck of the pancreas, the portal vein and the superior mesenteric vein. The anterior relation of the neck of the pancreas is the pylorus of the stomach. Pylorus of the stomach. Perfect. Okay, fine. Now coming to the body of the pancreas. Bacho, can you tell me who's this? Who's this? Body of the pancreas. What is this structure? Related superiorly to the body of the pancreas. What is this? Superiorly to the body of the pancreas. That's a splenic artery. Very good. That's a splenic artery. So related to the superior border of the body of the pancreas is the splenic artery. Now, there was one structure which was crossing the pancreas through and through like this. What's that? What is this structure? There's something which crosses the entire pancreas. What was that? That's a transverse colon and mesocolon. Transverse colon, and the mesentery of transverse colon is known as transverse mesocolon. Very good. And bacho, look at this. Look at this. What's this structure here? What's this structure here? Like this. What's this structure here? That's the stomach. That's the stomach. So anterior relations of the body of the pancreas, superiorly the splenic artery. Anteriorly is the transverse colon. The stomach, है ना? तो stomach bed में आता है ना, stomach bed में what comes is the pancreas, right? The anterior relation of the pancreas, the stomach, the transverse colon. Now, what is difficult is this posterior relation of the body. The slides are beautiful, students. Just try to understand the slides. This would be easy then to understand. Okay. The posterior relations of the body of the pancreas. Can anyone tell me? I'll just put numbers here for you. We'll start here. Number 1 is this. Number 2 is this. Number 3 is this. 4, 5, 6, 7. Okay, come on. Posterior relations of the body of the pancreas. Anyone? So we'll start like this. Posterior relations of the body of the pancreas from the right side to the left side. 1 is the aorta. One is the aorta with the superior mesenteric artery. Number 1 is the aorta with the origin of superior mesenteric artery. Number 2 is the left renal vein. Just see the slides, but are beautiful, and you need to draw all this. Number 3 is what? Any guesses? Aorta giving superior mesenteric artery. Yes, aorta with the origin of superior mesenteric artery. Number 2 is the left renal vein. Number 3 is the left crus of the diaphragm. Number 4 is the splenic vein. Number 5 is the left suprarenal. Number 6 is the left kidney. That's it. So the posterior relations of the body of the pancreas, from the right to the left side, 1 is the aorta with the origin of superior mesenteric artery, the left renal vein, the left Plus of the diaphragm, the left kidney, the left suprarenal gland, and the splenic vein. That's okay. Huh? You understanding now, all of you? Yes? Are you able to follow all this? It's a very rapid revision. It's a quick revision. Okay. The presses of everything that you have read throughout the year. Okay. Fine. Perfect, bachcho. Okay. Right now, see, pancreas, if we teach, it will take 1 hour. It's a full lecture on pancreas. But this, in 5 minutes, you can revise. And this is the way you're going to revise in the exams. Before the exams, not in the exams, before the exams, the day prior to the exams. So just sit back, relax, and just try to recollect pancreas. Okay, I know. Head, neck, body, tail. So head relations. Then comes the relations of the neck. Uncinate process. Like that. So this is how you're going to, yes. Pelvis anatomy thoda tough hai. Yeah. And the tail of the pancreas enters into what? The tail of the pancreas enters into the hilum of the spleen. The tail of the pancreas lies in the ligament. Can anyone tell me this? The tail of the pancreas lies in the ligament. What is that ligament? The tail of the pancreas lies in the ligament. That's the linorenal ligament. Linorenal ligament. So, when we are removing the spleen, when we are doing a splenectomy, you have to cut the linorenal ligament. When we are cutting the linorenal ligament, we have to be very careful because that linorenal ligament contains the tail of the pancreas and the maximum islets of Langerhans are present in tail of the pancreas. The maximum islets are present in tail of the pancreas. So if we cut the tail of the pancreas, the person gets diabetes mellitus. Yaad rakhiye. Just remember all this. Okay. Fine, bachcho. Just one last relation is left. Uncinate process ka relation. Uncinate process ka relation. Anterior. Just see the slide and tell me who is anterior to the uncinate process here. What lies anterior to the uncinate process? There are ads coming in between. What lies anterior to the uncinate process? Any guesses? Anterior to the uncinate process? Kya bacha? Is the superior mesenteric vessels, the artery and the vein. Superior mesenteric vessels. Third part of duodenum nahi bacha. Third part of duodenum niche hai. So the superior mesenteric vessels. Superior mesenteric vessels is related anteriorly to the uncinate process, and the posterior relation of uncinate process is what? What is this big vessel? Aorta. This big aorta will be back. No? This big aorta goes behind. Just see the slides. Try to understand the slides. The more you look into the slide, the more your concepts are going to be clear. Abdominal aorta. We draw this. Anterior relation of uncinate. This is the uncinate process. No? So anterior relation of uncinate process is superior mesenteric vessels. Posterior relation is abdominal aorta. Perfect, bacho. Clear with the pancreas? Embryo, I'll take a different lecture for you. The entire embryo. Maximum what is important, that will do. Okay, regarding the spleen, spleen comes as a short note. This is 1, 3, 5, 7, 9, 11. So 1, 3, 5 are the dimensions of spleen. 1 inches in length, 1 inches in thickness, 1 inches in length, 3 inches in breadth. 1, 3, 5. These are the dimensions of spleen. 7 ounces in weight. And the spleen is present between the 9th and the 11th ribs. Between the 9th and the 11th. Harris dictum. Yes. The long axis of the spleen is directed along the 10th rib. The long axis of the spleen is directed along the 10th rib. It is between the 9th and the 11th ribs. The long axis is directed along the 10th rib. Here, the spleen makes an angle of, how many degrees is this? The spleen is like this. The spleen makes an angle of how many degrees? Can anyone tell me? With the horizontal plane. Yes, bacho. 45 degrees. Very good, Shantanu. Excellent. The spleen makes an angle of 45 degrees with the horizontal plane. Now tell me, bacha, which border of the spleen is notched? If I ask you this in Viva, Which border of the spleen is notched? Any border can be notched, but generally the superior border of the spleen is notched. Generally the superior border is said to be notched, but notches can be present along any border. Remember, not necessary superior border. Notches can be present along any border. What does the notches indicate? That the spleen has developed from small lobules. As the lobules are there, and this small lobules, they fuse, and where they fuse, you get notches. So notches just indicates that the spleen has developed from small lobules, and जहाँ पे ये fuse होते हैं, you get notches. So generally the superior border is said to be notched. Notches can be present along any border. Spleen projects into which part of the peritoneal cavity? That's a very important MCQ for you. This was a PG NEET MCQ, AIMS MCQ. Spleen projects into which part of the peritoneal cavity? Let's say we have got two. One is the greater sac, one is the lesser sac. Tell me. Spleen projects into greater sac or lesser sac? Spleen projects into... that is fine, bacha. That is fine, Harshika. But spleen projects into which part of the peritoneal cavity? Greater sac. Lesser nahi, bacha. Lesser nahi hai. Spleen projects into the greater sac. Spleen projects into the greater sac. That's light, but let me see if I can extend this to you. Spleen. Okay. Look at this. Look at this. You see the boundaries of the lesser sac. Lesser sac ka left boundary is formed by what? Can anyone tell me? The left boundary of the lesser sac is formed by what? One moment. See, one moment. I'll make it like this for you. See, a diagrammatic representation. ये कोरिलेट नहीं हो रहा है. देखो ना बच्चा, एक मिनट रुको ना मेरे बच्चे. Just wait, no. I'm telling you, no. Okay, yeah, now if I draw it, it should be on this side. Now tell me. What have I drawn for you? What have I drawn for you? अब समझ में आ रहा है? Yes, you tell me, what is this number 1? What is this number 2? अब बोलो, चलो बोलो. The left boundary of lesser sac is formed by what? Yes, very good. The left boundary of lesser sac is formed by what is this? This is the gastrosplenic ligament. The left boundary of this is the gastrosplenic, and what is this? Linorenal ligament. Gastrosplenic and linorenal ligament is going to form the boundary of the lesser sac. So what is all this, bacho? What is all this? What is all this? What is all this that I have drawn? Greater sac. Ab samajh mein aaya? Now is it clear to all of you? That's a greater sac. So spleen is going to project into which part of the peritoneal cavity? Greater sac, my children. Greater sac. Spleen is going to project into the greater sac. And what is this? What is this that I have done for you? Up clear? Now is it clear? Understood, no? This is a diagrammatic representation. Just a way to understand diagrammatic representation. Hey, bacha, Tariq, le lo. That's fine. If you're running short of time, you can take that. App pe sare lectures hai. There are all lectures on PW app. You can get this question answers, bachon, in the FARRE textbook. FARRE series hai. You can get the textbook. You can get the books. In that you've got question answers of different universities as well as MCQs. Perfect. Right. Okay. Now you tell me what is this? This is Cohen's classification video. Can anyone tell me the ligaments of liver? For this, let me just tell you the ligaments of liver. Any guesses? Ligaments of liver. One is the falciform liver. Falciform ligaments. The moment you hold the liver, practically the examiner tells you what is this, but you say liver, okay, you take it in anatomy, you hold it in anatomy position, you put your forceps in the IVC and leave the liver support, support. So that's the anatomical position of liver. Fine. The next question the examiner is going to ask you, what are the ligaments of liver? So your first answer, falciform ligament. What is the falciform ligament contain? बोलो बेटा, मेरी तरफ से ठीक है, थोड़ा रिफ्रेश कर लो स्नेहजीत, रिफ्रेश. Falciform ligament contents. Any guesses? What are the contents of falciform ligament? One is the ligamentum teres, and yes, ligamentum teres. And contents of falciform ligament. We are talking about ligaments of liver. Number one is the falciform ligament. Falciform ligament, ligamentum teres, and para. You should know. This you should know. Falciform ligament में क्या होता है? The ligamentum teres and the paraumbilical vein. The same paraumbilical vein which gets dilated in portal hypertension. The same paraumbilical vein which gives rise to a condition which is known as caput medusae. Caput medusae. Falciform ligament. Second, what are the ligaments of liver we are talking about? Second is the superior and layers and inferior layers of coronary ligament. Superior and inferior layers of coronary. What else? Triangular ligament. अगर liver is asked in the viva zone, this might default the examiners pass. So what are the ligaments of liver? Number one is the falciform ligament, one hence ligamentum teres and the paraumbilical veins. The superior and inferior layers of coronary ligament, the right and the left triangular ligaments. And all this is derived from what? Any guesses? If anyone can answer this. ये जितने भी ligaments हैं are derived from. Answer this. Yes. All these ligaments are derived from. Any guesses? Ventral mesogastrium. Okay. All these ligaments are derived from ventral meso. Okay. So जितने ligaments are liver, because the liver is growing in what? Ventral mesogastrium, and all the ligaments of the liver are therefore derived from ventral mesogastrium. A very, very important viva question. Very important viva question. Okay. So all these ligaments are derived from ventral mesogastrium, which are the areas of liver. The very important viva topic. The bare areas of liver. The areas which are not covered with peritoneum are known as bare areas. So which are the bare areas? Number one, the fossa for gallbladder, the two for IVC, then the porta hepatis, the fissure for ligamentum teres, the fissure for ligamentum venosum, and the largest bare area is known as the bare area. The bare. Are you able to follow this, Bacho? Are you able to follow this? So, what are the bare areas of liver? The areas which are not covered by peritoneum are known as bare area. Yes, Anaka, very good. Huh? Yeah, it is very difficult to teach a so big topic, and that's okay. Forget it. The rest of the students. So the bare areas. I hope the rest who are listening are able to follow. ये सब पूछेंगे. If I come as an examiner, I'll definitely ask you. Okay. So the group for IVC, the fissure for ligamentum teres, the fossa for gallbladder, the falciform ligament, the area for falciform ligamentum teres. The bare area. इसके boundaries बोल सकते हो. Can anyone tell me the boundaries of the bare area? That's the largest bare area. Students, you know this? The bare area of the. Yes. What are the boundaries of the bare area? This is the IVC. This is the IVC. This is the layer of coronary ligament. Diaphragm नहीं है, अच्छा diaphragm नहीं है. This is the inferior layer of coronary ligament. Superior layer of coronary ligament, inferior layer of coronary ligament, and what is this ligament? What is this? This is the right. So this you should know, my child. This you should know. So this big area is not the bare area. This is the superior surface. Superior surface of ligament. What are the boundaries? Anteriorly is the layer of coronary ligament. Behind is the inferior layer. The apex is formed by the right triangular ligament. The base is formed by the IVC. IVC. So this becomes the bare area. The bare area. Okay. Now what's classified? This is classified by Conard. What's classification? Conard's classification is based on what? What is this? Anyone tell me? This is an MCQ for you. This was a PG NEET MCQ. So what is this and what is this vein? So Conard's classification is based on answers. Number 1 and number 2. Conard's classification is based on what is number 1? Any guesses? Number 2 is portal vein. Anaka. Number 2 is portal vein. What is number 1? Number 1 is not IVC. अरे बच्चे IVC नहीं है. That's the hepatic vein. Hepatic vein. See, I'll put it like this: number 1, number 2, and number 3. So who's number 1? That's the number 1 is the middle hepatic vein. 2, okay. Middle hepatic. 2 is right hepatic vein. And to make this number 4. Number 4 is Conard has classified this liver based on the hepatic vein and the portal vein. So hepatic veins can, one is the middle hepatic vein. The middle hepatic vein divides the liver into a right lobe and a left lobe. The right hepatic vein, this is the right hepatic vein, divides the liver into an anterior part and a posterior part. Anterior and posterior. The left hepatic vein divides the left lobe into a medial and a lateral. Okay. The left hepatic vein divides the left lobe into a medial and lateral parts. The right hepatic vein divides the right lobe into anterior and posterior part. The portal vein divides the liver into a superior and inferior segment. Superior and inferior segment. So this is about superior segment. This below is inferior segment. Are you able to follow this, Bacho? One minute. One second. So now you check the middle hepatic vein. Is the middle hepatic vein. That the middle hepatic vein divides the liver into right and left lobe. The right hepatic vein, that's the right hepatic vein, divides the liver into, divides the right lobe into an anterior and posterior segments. The left hepatic vein divides the left lobe into medial and lateral segments. The portal vein divides the liver into a superior and inferior segment. So what is segment number 1? Segment number 1 is the caudate lobe. Caudate lobe. Okay. Then segment number 2 and 3. This is 2 and 3. Segment number 2 and 3 is left and 3. Left lateral. This is 4, 8 and 4, B, that is left medial. 5 and 8 is right anterior. 6 and 7. 6 and 7 is posterior. Crack ho raha hai? Hello. So sorry for that. I'll just tell the team. I'll tell the team. Snitch it. So what is number one? The segment number one is a caudate lobe. Segment number 2 and 3 is left lateral. 4 and 4B is left medial. 5 and 8 is right anterior, and 6 and 7 is right posterior. Right posterior. Okay, I'll inform the team. Voice is cracking. I'll inform. Is this clear to all of you? Okay, the last part is clear. Sajid, you, Rutvi, Anaga. Segment 1 is the caudate lobe. 2 and 3 is left lateral. 4A, 4B is left medial. 5 and 8 right anterior. 6 and 7 is right posterior. Huh? Yes. 4A and 4B is same. Quadrate lobe. Yes. Quadrate above. Fine. This much is fine. Okay. This much is I'll take one more lecture and I'll finish. Fine. The rest of the things will take one more lecture and we'll finish off. Okay. I hope this much is clear, students. The next lecture would be on Sunday. Next lecture would be on Sunday, not on Thursday. Thursday ko lecture nahi hai. It would be on Saturday or Sunday. I'll put this on the Telegram group. I'll put this on the Instagram also. So the next lecture is going to be on Saturday or Sunday, not on Thursday. Okay. Read this much, revise this much, then the other lectures I'll contact. Okay. Thank you, my dear children. Thank you to all of you. Thank you for a patient listening. Thank you. संडे में बोलता हूँ सैटरडे और संडे टाइम आई लेट यू टाइम आई टेल यू थैंक यू बच्चों थैंक यू ऑल ऑफ यू